We're at a time where we have several amazing agents that are available for patients with CLL. These include BTK inhibitors, Venetoclax, a BCL2 inhibitor, also Idelalisib, a PI3K inhibitor. One of the major limitations of the clinical trials that have been conducted to date is that there's no head-to-head comparisons between these agents. And this is something that patients really want to know, and this is something that practitioners really want to know. How should we sequence therapies? How should we select a first novel targeted agent for patients? So what we did was we put together a partnership between several centers in the US and the UK to pool all of our data together. And we specifically wanted to ask the question, in the relapse refractory setting, can we compare outcomes for first novel agents? So first novel agent being either Ibrutinib, Venetoclax, or Idelalisib. Were those patient populations comparable, and were the outcomes comparable? And the main takeaway from the study was that, in particular, when we compare Ibrutinib-based therapy to Venetoclax-based therapy, in terms of progression-free and overall survival, they are quite comparable. So we could not discern a difference between the groups. We did see some differences in terms of discontinuation rates, reasons for discontinuation, and adverse events. But I think the endpoints that matter the most to the patients are progression-free and overall survival. They were comparable. It provides reassurance that with either agent being selected as first targeted agent, that you'll have a quite excellent outcome. The other take-home from the study was what we did do a comparative analysis of Idelalisib-based therapy, and there it was interesting. Both Ibrutinib and Venetoclax seemed to be better in terms of PFS and possibly even overall survival. In addition, the discontinuation rate was 95% for the Idelalisib, or nearly 95%, speaking to the adverse events that led to discontinuations for that particular agent. So it's one more piece of information that guides us in terms of how to sequence agents and provides reassurance about which therapy should be selected.